I'm on it. Hello, hello. If you caught that first error, for some reason my camera was out the wazoo, so I had to fix that. This is your truly Dr. Barry, board certified internist, your founder at drpiersblog.com. Author and speaker, you are now watching another edition of the Lunch and Learn with yours truly. And today we're going to be talking about medical marijuana. But like we do every Tuesday and Thursday, we're going to do a couple housekeeping things. I'm going to share this video on my personal page, and we can kind of get this thing started. Again, I want to apologize. Clinic ran a little bit late today, which is okay. People had to be seen, people had to be taken care of. So we're going to give you guys some time to get up on here and get started. Again, interesting topic today, medical marijuana, a question I get probably 2 to 3 times a week on it. So we're going to get things started right away. Give me a second. Let's see. Alright, just had to find a video. Alright, share it to my page. Okay, we are there. Again, for those who may be catching on, Dr. Barry, board certified internist, founder of drpiersblog.com, author and speaker, bringing you another edition of this week's Lunch and Learn. Today's topic is a very interesting one, medical marijuana. I tell you, I get this question probably 2 to 3 times a week. Especially, I'm a South Florida physician, and we just recently passed legislation to be able to approve medical marijuana. And of course, if you've been following along the blog, I did have a blog post kind of talking about my stance on marijuana in general. It was specifically medical marijuana in general, and how I kind of had to change, do a 180 on that. I can tell you I was the victim of some early propaganda and really didn't believe any of the benefits that could have been seen using medical marijuana. But again, I am a changed physician, and especially because I kind of really much did my own homework, and we kind of got to the bottom of why there was opposition for medical marijuana, why it isn't as widespread as it is. So I just wanted to kind of give a quick rundown on what is medical marijuana, because when we talk about marijuana, our TV, we automatically go to like referring to like smoking a joint in that regards. And I had to learn, again, it was new to me. I had to learn that the marijuana comes in, especially the medical version, comes in so many different strains and versions in terms of it comes in gummy flavor, it comes in liquid gel caps, it comes in sublingual tablets, comes in liquid form that you can drink. So there's a lot of different variations of the THC, which is really when we're talking about marijuana, our big medical component regarding it. So that was something I definitely had to do some research on my own, because again, I was on the fence. I thought most of the propaganda behind the benefits of medical marijuana really came from people who I just thought just enjoyed marijuana, but it wasn't until I did my own homework and I got to the bottom of things where I really kind of turned that corner. And what I will do, I will post a link to that blog post I wrote, I think it was in September, regarding medical marijuana and the stance I had on it. So let's talk about what types, especially let's specify, especially in Florida. In Florida, there's a few different diagnoses that you can use to actually treat marijuana. For your patients who are diagnosed with cancer, medical marijuana is now for patients with epilepsy, which is seizures, patients with neurological disorders, and particularly multiple sclerosis, Lou Gehrig's disease, again, an indication for marijuana. Patients with PTSD, again, marijuana has been shown to have immense benefit. And that's what in Florida we allow to prescribe medical marijuana. But across the country, you have chronic pain being treated with medical marijuana. You have anxiety, you have insomnia, you have depression being treated with medical marijuana. So it definitely is a wide range of options for it. Me personally, when I talk about the treatment course and what I see on a day-to-day basis, I have a lot of patients. I have a lot of chronic pain patients. I have a lot of patients who are on anxiety medications. I have a lot of patients who are on sleep medications. And the biggest drawback for all of the medications I have is that the highly addictive properties that go along with it. Where, in 1 year, you could have been on a certain dose of medication, works very well. And then, by year 2, that same dose doesn't work. So what happens? You have to go up. And then by year 3, you have to go up. And that's where the addiction starts playing effect. So you have a lot of, especially now where opioid addiction is like popular now. And we'll probably have lunch and learn on the hypocrisy of our government being very gung-ho on opioids all of a sudden. We'll leave that for another lunch and learn. But you have the opioid crisis epidemic per se that's very big, and you have a medication again. When we talk again, our topic of today is medical marijuana. You have a medication that we know works extremely well for it, with none of the addictive properties, especially for like the opioids, none of the withdrawal properties that these opioids and that these benzos have. But the question is, why aren't we doing more with it? And this is where I had to do some homework. This isn't something that you'll just, if you're in that circle of medical marijuana, you'll know about it. But this isn't something that you'll be able to read right off the bat. I think the first thing from a legal standpoint, our federal government actually designates marijuana as a Schedule I drug. And what does the Schedule I drug mean? Again, for most people, you're never going to have to know about it. It's not something, it's from a physician standpoint, I have to know very well about it, especially when we're talking about for controlled medications. But medical marijuana is a Scheduled I drug. And what that does is that says that even the ability to do research on a drug like marijuana is so strictly regulated that most people just don't do it. So you'll hear a lot of caveats. Well, we don't have enough information of how much it can treat. We don't have enough information to know if it does well with the chronic pain, if it does well with anxiety, sleep medication, all those other things. And that's kind of the half truth. Yes, we don't have enough information, but our government doesn't allow us to have enough information because of how they scheduled marijuana. And even just as recently as earlier this year, when they had the chance to declassify marijuana into a Schedule II drug, Schedule III, where we'd actually be able to do some great research on it, the federal government passed on it again. So again, we're waiting a whole nother calendar year for the government to kind of get around and catch up to the ballgame. I read medical stories all the time about how the number of prescriptions for opioids like Percocet, Oxycodone, Vicodin, all those medications have dropped in states that allow medical marijuana. How the prescriptions for your Xanaxes of the world have dropped in states that allow medical marijuana, especially for anxiety, and how medications for sleep, which again are usually a lot of our benzos, have significantly dropped because of states passing medical marijuana. Oh, hey Jen, my cousin Jen is on the video today. So it's very a half truth that we have to deal with medical marijuana. And again, I was one of those ones in the health field who are like, nope, we don't need medical marijuana. It's just for the people who want to, get quote unquote high. And I had to come around. So I definitely think it's something that, as if you're a physician, as you're, the people's physician here on the Facebook page, hello, Jen, that we have to educate our patients and then really educate ourselves, because we can't continue to peddle the lie that we've been peddled as far as like how bad medical marijuana is, especially when we know we have drugs that are just as worse. Like I said, unfortunately, I got patients who are on chronic pain medications, can't get them off those pain medications. I have patients who are on chronic benzos for anxiety and stress and everything else, can't get them off those medications. I have patients who can't sleep for thousands of reasons, can't get them off these medications here. But we have a treatment that we know works. Like it's not even like kind of like folktale anymore. We know medical marijuana works for these medications, works for these disorders, but we can't get our government to kind of go along with it, which again is unfortunate. Again, I'm in Florida. Again, we just passed medical marijuana, and I talked about reasons that you can get it, especially again if you're a Florida resident right now. I can't prescribe it because my job doesn't allow us to, because you have to get like this as a physician. I got to get a whole certificate and all these other things, aka I got to pay a license to get it. My job is not doing that right now. But disorders that you can get to cancer, PTSD, neurological diseases. If you have trouble eating, cachexia is another almost like a muscle wasting type disease. We know that a medical marijuana works extremely well for these patients here. So I just wanted to kind of do a nice little fun lunch and learn. Again, it's something. It's a topic that I get all the time. Especially since we passed it here in Florida. We already had patients calling the office, hey, is Dr. Barry going to be prescribing marijuana? Is Dr. Barry going to be prescribing marijuana? And, after I educate them and say, yeah, but the disease you have, you can't get it anyways, they kind of go on their way, which is all right. So for that, again, I'm going to post a link to that blog post I did. Again, I did it in September when we were ready to go for the treatment course as far as oh, hello, hey everybody, this is the oldest one here. Say hello. You gonna say hi? Hi. All right, let daddy go back to work. What was I say? Oh, okay. So I'm gonna post a link to. Oh, hey Amanda. No, I did not, because Bethesda, where I work at, is being very slow-footed as far as if they're going to allow us as physicians to prescribe it yet. So we haven't had a definitive answer on if we're going to be allowed to prescribe it. So I have not done the 6-hour training, and that's what I kind of referenced to earlier. For if you're a physician, health practitioner, I'm not sure it's just physicians, but I know if you're a health practitioner in Florida, you have to go through this training course to be able to prescribe the medication. Hey, hello, Maria. Hello, that's my wife. Watching the video cast today. You have to go through this training course to be able to prescribe it. So, even though I'm a board certified internal medicine physician, I can't just write for marijuana. I actually have to go through this course where I go through the pros and cons. I talk about all the harmful effects and everything else which goes on. It's not a difficult thing to do. It's just really dependent on, especially if you're a solo practitioner. It's just a question of who is actually just going to go ahead and do it. Again, it's I think the test, I want to say, last time I looked, was maybe $1,000. So it's not a difficult thing to ascertain. It's not something that you have to pass this huge test about. It's just more of actually going in and doing the training in that regards. And so far, my job hasn't decided if we're going to be allowed to do it yet. So I haven't done it yet. But again, I am a big proponent of it. I say that multiple times. I've wrote about it multiple times. I definitely think that the drug companies play a big role in it, because again, imagine if you're the makers of the oxycodone, the Vicodins of the world, the Xanaxes of the world, and that if medical marijuana becomes more of a common drug to prescribe, all of a sudden doctors are going to be prescribing your drug less. So so they have some financial incentive to make sure medical marijuana doesn't really see the light of day as it should. as it does in, Colorado and all these other states here. And again, it's very important to understand that even though your state passes it and makes it legal, federally, we still don't recognize it as being legal. So that's why you still have these caveats. That's why you still, if you're working at a job that requires drug testing, you can still be fired from that job, because federally, they don't have to recognize what the states do in that regards. So again, thanks you guys for joining, for listening, for my long cast about medical marijuana. Full disclosure, I am not sponsored by anyone. This isn't, no one's cutting me a check to talk about the positive benefits of medical marijuana. I just see that I have lots of patients who would greatly benefit off that medication and off that drug in that regards. Yes, actually, Jen, yes, I do. I think that the ones who make marijuana, of course, they're going to benefit, because they'll be able to, it's pretty much a cash flow market. Once they say these disorders are allowed to be prescribed for medical marijuana, more physicians, especially once they get better acclimated to, will continue to prescribe it. And on the other side, if you're a pain company if you're the opioids, if you do Percocet, Vicodin, if you do Xanax, Resveratrol, all of these other medications out here, and all of a sudden you're going to see your numbers drop. And we already know that. Like, it's not like conjecture anymore. We have studies now that show that in states that show that medical marijuana is legal, those prescriptions drop. And when those prescriptions drop, we're probably talking about millions of dollars that they're losing a year to something like marijuana. So yes, I definitely think there's some financial ramifications of why it really hasn't caught steam and hasn't been legal in all 50 states in that regards, because I think that's really the big, and of course we're in America, where money unfortunately runs our medical industry. So definitely something that I hope in the future, and again, especially in Florida, we have to wait at least another year for the FDA to decide whether they're going to declassify it and make it more easier for us to do research on it. So we have to wait at least another year for that to kind of go around. But till that time, I'm going to be here. I'm going to be promoting, championing the use of medical marijuana, and hopefully championing the least or decrease in the use of all of those other bad medications. Because again, all those other medications I talked about, we know what the side effects are. Like, it's just not. They're just not good. And ask your patients or friends or family members who who are on some of these medications, ask them how hard it is to get doctors like me to write it. I mean, I actually have no problem like writing it. It's not a big thing for me. We do very well as far as our legal aspects of it and checks and balances of it. But you have some doctors who won't write for chronic pain medication. They'll send you to a pain management person. You have some doctors who won't write for your Xanax and all that other stuff. They'll send you to like psychiatrists or something like that, which is crazy. Oh, Cam, what's going on, Cam? We're talking about our medical marijuana. I'm actually about to head off, but we'll have this video live streaming later today, and then I'll actually have this video on the website as well. So if you don't catch it here, it will be on the website under the video section later on today. So again, I got to run. My wife's giving me dirty looks. You guys have a great, blessed day. Thank you for watching the video, learning about medical marijuana. If you have any questions, concerns, leave it in the comments. I'll answer them. I'm good, bruh. If you have any questions, concerns about medical marijuana, yeah, she's still giving me dirty looks. Leave them in the comments. I'll answer them. Leave them on the face. Go on my website. I'll answer them there. If you're not on my listserv, join the listserv as well. Y'all guys have a great and blessed day. Bye.